Hey guys, my name is Dr. Larry Burchett. I am an ER doctor and hospitalist. I did family medicine residency in Martinez, California at Contra Costa. I went to med school at the University of Kansas, got my MD in 2006, and graduated Notre Dame undergrad. I want to talk today, this is for medical students and residents, about how to do well on rotations to get good grades. In med school, your rotation grades are probably the most important thing that gets you into the residency that you want. In residency, your grades and passing the rotations are not as big of a deal. You're probably going to graduate, but certainly doing well in those can open up opportunities for you, especially if you want to specialize, etc. So doing well in your rotations is key. I've been in attending, I've had medical students, I've had residents work for me. It's very obvious to me at this point. I don't think I understood it at the time. I think I thought I could kind of fake it a little bit, to be honest, make somebody believe that, but it is very obvious who the better students are and who are the ones that just kind of clock in and clock out. Okay, so let me give you a couple examples. Most students and residents aren't bad. Some are bad, and that's obvious, and they're disasters, and that's a whole nother issue. But I would say most are just kind of average and not memorable. In my experience, most kind of did the job, showed up on time, clocked out on time, took the average number of patients, asked a couple questions, kind of did this thing. But the main thing that they lacked was kind of a genuine enthusiasm or excitement about, or interest in actually learning. So in my case, most of the residents and med students I've had have been in ER. Just not that interested in it. Now there's two things that I look for in a really impressive, good resident or medical student that I would love to write a letter for. Number one is that genuine enthusiasm. They show up excited. They ask questions that show they're really thinking and that they give a shit. They don't ask just questions to show me that they're asking questions, right? To kind of play the game. You can tell there's a bit of a difference. The second thing, so kind of this genuine enthusiasm and interest, which I think anybody can choose to have. Maybe you're not going into radiology, but most specialties are going to use radiology from OB to ER and family medicine. I mean, most specialties are going to use some radiology, in the care of their patients. So it seems to me that it's worthwhile while you're there to kind of learn as much as possible. You ought to be able to get that one together. And then the other part is when a med student or resident demonstrates not only genuine interest and enthusiasm, but demonstrates that they're learning, that they didn't know something one day and then they know it the next day and they've applied it. That really shows me that they're really in it, that they're really in it. They're really trying to become a better doctor in this process. And as people who are attendings, think about your attending for a minute. And I don't mean to play them, but just think about that. We want to teach. We want to see people learn. We're teachers, so we love it when people actually learn and get better and demonstrate that what we're doing for them is meaningful. Let me give you a good story. And this guy he was a pre-med. We had looked at a normal hip x-ray. And I said, look, this is normal. You can see the contour of the head of the femur. Here's the neck of the femur. See how it kind of goes like that? It's smooth down into the shaft and the body of that bone. Normal x-ray that we reviewed. Not I'll be honest, at that stage I probably would not have been that impressed. I would have been a little bored. I'd been show me some blood and guts. I want something sexy. But he looked at it and he took it in. This kid this is Jorge. He was motivated to learn. He just sucked stuff up. I loved it. He told me later that a week or two after he and I had reviewed that, they had a patient who had a lot of hip pain. The ER attending said there's no hip fracture, and the radiologist who looked at it also said no hip fracture. But he took a closer look and he said, I think there's an irregularity here in the neck of the femur, which we had reviewed. You might think about doing a CAT scan. I think it turned out that the patient couldn't walk and had difficulties, whatever, so they did a CAT scan of the hip and picked up an occult fracture. Now, as an attending that taught him that, that's the ideal student. He learned something as a pre-med. He wasn't even a med student or resident. And he learned it so well that he overcalled the attendings. You think I'm going to write a letter for that guy? You think he's going to get an A in the rotation? You bet he is. That kind of stuff. For me, people don't have to come in early. They don't have to stay super late. They just got to be present, engaged, interested, and they got to learn something. So I think if you take that stuff and you head into these rotations, again, your clinical rotations, getting A's, getting the highest marks in there only gets you to the next step. It's probably the most important thing in you getting, the kind of career that you want next. That's how I would advise you to get the most out of those. I hope you enjoyed this. There are more videos for pre-meds, med students, and residents. Tune in for those. Follow this YouTube channel to get them. I'll see you next time, and good luck in your studies and your career.